I'm Soledad O'Brien. Welcome to Matter of Fact. A new study out of Harvard University is upping the estimate of the dead in the wake of Hurricane Maria in Puerto Rico. The new number is just under 5,000, and that's 70 times higher than the official death toll of 64. The research team didn't only count the bodies after the storm hit back in September. They also talked to families, surveyed households, asking about their experiences in the weeks and months after the hurricane hit. That's when most of the island was without power, and the infrastructure was in ruins, and medical care was difficult to get. The death toll is a controversial subject because many argue both the federal government in Washington and the local government on the island did not respond quickly or thoroughly enough after the storm. Dr. Erwin Redlener is the director of the National Center for Disaster Preparedness at Columbia University, and he joins us from New York today. It's nice to see you, Dr. Redlener. It's been a long time since we've had a chance to chat together. How were these numbers so completely off?
Well, the numbers that are off are actually the original predictions, and the number that the government was trying to still sustain was less than 70 people having died in the hurricane, in the immediate impact of the hurricane, meaning drowning, debris, blunt trauma, and that sort of thing. But back in October, I was saying that this is going to be many, many times worse than people are saying right now, because it was inevitable without electricity, with the roads being knocked out, with healthcare facilities being closed. It was very clear to many of us in public health that access to healthcare, and not just access to doctors, but access to medications, access to power to run their mechanical ventilators and all of that would be a problem.
Were you surprised by this Harvard figure of just under 5,000? Do you think it could still go higher?
And don't forget that Puerto Rico has very high poverty rates, very high rates of diseases and complications of diseases that are related to poverty and lack of access to health care. This predated the storm. So these were highly vulnerable people in Puerto Rico, living in Puerto Rico, and we're now seeing the consequences. It could go significantly higher.
The president bragged in pretty much the immediate aftermath of the storm, when the official count was somewhere around 17, that Maria, which was a bigger storm than Katrina, in his words, was actually that the aftermath had been, basically the role of his administration had been so far superior. Do you think there was an intentional lack of, I don't know how to put it, aggressiveness and transparency, maybe is the way to put it? Or do you think that this is just the way it works, and over time you get a more accurate count of how many people have died in the aftermath of any storm?
It's not just the fatality rates. I've been there probably 5 times now since the storm, and there's many, many people that are still suffering. You go up into the mountains, you look down into the valleys, there's many, many houses that are still covered in the blue tarp. That the recovery is barely really just beginning, and that means not just the recovery for housing and electricity, but access to health care as well. So I don't know what the president's motivations or the factual basis of what he was saying is at all, but I do think that what he was saying could not be possibly construed as accurate.
There are other studies that'll be coming out, right? GW has a study. I know RAND is also working on a project as well. Tell me a little bit more about what you expect to come down the pike and how that'll inform people like yourself who really are not just looking at collecting data, but want to do something with that data for the future.
I think all of these are going to lead to the same conclusion, that the number of deaths was not under 100. It's actually in the many thousands. But the point is that there are issues that cause the fatality rates to skyrocket in the aftermath of a big disaster like this. So for me, who's interested, I'm interested in the policy. I'm interested in how rapidly the recovery should take place. I'm interested in how to make the health system more resilient for the next storm.
Dr. Erwin Redlener, thanks for joining us. Appreciate it.
Thank you.